hold still.
I'm breathing.
You moved your head.
Shaun, go away and let the technician do his job.
I sent him out for coffee. I am now scanning the location of your prior tumor. Did you decline maintenance chemotherapy?
It's hard to hold still while I'm talking.
Dr. Blaze recommended 6 cycles of temozolomide.
The slight benefit of that stuff wasn't worth the constant nausea.
The benefit is statistically...
Shaun, I made my choice.
You chose wrong. There's a spot on your brain. This paper by Dr. Alice Chen features interesting data on tumor treating fields for GBM tumors.
I'm trying to enjoy my tuna melt.
Dr. Chen is starting a new study soon. You should call her.
I'm not going to spend the day chasing down cancer treatments because I don't have cancer.
Okay, there is a higher probability of cancer relapse because you refused maintenance chemotherapy.
I'm not going to talk about this.
Recurrent GBM causes much worse symptoms than temozolomide.
That's the decision I made.
I'm going crazy. There are 3 crib sets I like. I just can't decide. Could you guys go to the store after work tonight and pick your fave?
Okay.
Oh my God.
Should I be worried?
About me? No. If I have cancer, I'd be at stage 4, right? There's no miracle cure for that.
Still haven't called Dr. Chen in Cleveland.
I read her paper. It doesn't work with recurrent GBM.
How can you think about teddy bears when you might be dying?
If you're right, Shaun, then I won't be here when your son is born. I won't be here to help you. We'll know when we know. I like the lighter wood.
So do I. What else should I know about diapers? Why would your daughter shave your cat?
Long story. Point being, don't get a cat. Kids are going to tell you they're going to clean the litter box. They're not going to clean the litter box. Don't fall for that trap.
You made a lot of mistakes.
Yeah. All boils down to Maddie's mom basically raised her while I focused on work.
You were a surgeon. She was a real estate agent.
I love surgery. I love poking around in people's brains. It's very exciting. And I get to save some lives while I'm at it.
Saving lives is very exciting.
So were Maddie's first steps, her first words, her first piano recital, or so I heard. Work over family, and that's what you get. You're not going to make the same mistakes.
I don't think I will. We are very different people.
Are we?
I have learned some very useful things from you.
Well, right back at you.
The baby needs surgery. The crib needs to be assembled.
Go.
But you chose work way too often. When should I prioritize family?
When you have a sick baby and a piece of furniture, the sick baby wins every time. Go. I got this.
It's been 24 hours.
Yeah. I just need a minute.
A minute won't change the results.
No, it won't.
No cancerous DNA detected. I was wrong.
Yes, you were.
Advancing the catheter to assess posterior circulation.
Dr. Murphy, do you mind if I ask, why are you observing us?
I don't mind.
Why are you observing us?
I am not observing you. I am observing this case because it is interesting. Also because it is Dr. Glassman's and he may display additional symptoms that will help me diagnose his deteriorating executive function.
So you're worried because he forgot a couple of stitches on a routine close?
Stop! The third aneurysm is low-lying at the basilar trunk. That will be very difficult to clip.
And dangerous.
Definitely a very interesting case.
We'll approach all 3 aneurysms from a left-sided craniotomy.
Even though the ICA aneurysm is on the right side?
Yes? We'll go after the basilar first, as that is the most challenging.
What about the ipsilateral PCOM? It's pressing the third nerve and may rupture soon.
If you let me finish. Step 2 will be the PCOM. And after that, we will cut across the infield and go after the ICA.
Have you considered...
Shaun, will you stop? Will you just please stop? I'm fine. I know what I'm doing. My memory is intact. Does anyone have an actual objection to the surgical plan?
Nope.
No.
Thank you.
It is extensive and could put Ricky at risk for future seizures, and your outburst could indicate a lack of impulse control, which is a symptom of executive dysfunction.
I am exhibiting extraordinary impulse control as we speak. As to the risks, I have clipped over 2,000 aneurysms. Tomorrow morning, I'm going to clip 3 more. Put Ricky on the schedule. Go home, get some sleep.
My head! It's gonna explode!
He has a thunderclap headache and double vision.
His left eyelid's droopy. Looks like complete third nerve palsy.
Left pupil non-reactive to light. The PCOM aneurysm must have ruptured. We need to get him to the OR stat. Hey, Dr. Glassman. Intracranial pressure is dropping.
We brought him some temporary relief. Can we see the CT scans, the new ones, please?
Given the subarachnoid hemorrhage, the risk of the previous surgical plan has increased.
You can still clip the 2 smaller aneurysms and ligate and bypass the ruptured one.
We should consider coil embolization of the ruptured aneurysm. We treat that now and then come back for the other 2 once Ricky has recovered.
Then he has to come in every 6 months for an angiogram, weakening his muscles, damaging his coordination, effectively ending his pro career. That's your recommendation?
The treatment is a much safer option.
He's 19. There's lots of life to consider after baseball.
I'm confident in what I promised. I'm confident that I can deliver it.
Your experience mitigates the increased risks of the craniotomy, but it does not eliminate them. The patient should decide.
Fine.
That I might not walk out of here or walking out knowing that I'll never play ball again.
Yes, that is the question you need to answer.
Don't get stuck on worst case scenarios.
I worked real hard to get here, you know, and I got people counting on me.
Hey. Shut out the noise. Other people are going to have opinions, whether you swing 3-0, whether you don't take the extra base. Whatever decision you make, that's going to be the right decision.
You know, there's a saying back in the DR. You can't walk off the island. You gotta take big swings. Let's fix all the aneurysms then.
Good call. One down, 2 to go.
It's been 5 hours. Do you need a break?
Not when I have a 30-year-old McAllen waiting for me at the finish line. Fenestrated aneurysm clip.
We're gonna intra-op rupture.
Bleed is massive.
Suction, both of you, suction. To keep this field clear.
Should we try balloon occlusion?
Or flow diverting stent.
No, we should adjust the clips to get better proximal and distal control and move it to a muscle wrap.
Push 6 milligrams bolus adenosine. We're gonna stop the heart. Push it, please, push it. Aneurysm clips.
Oh, that is very innovative. Inducing a brief cardiac arrest reduces blood flow to the aneurysm.
Gives us time to apply the clips. Okay, let us proceed with the parent vessel reconstruction. One more time. Fenestrated aneurysm clip. Thank you. That was exciting.